Hi everyone, and welcome back to Abnormal Psychology. This week we're going to be focusing on anxiety disorders. Now, almost everyone knows what it feels like to be anxious before a test, during a job interview, when you have to get up in front of a classroom full of students and give a presentation, even waiting for an important phone call from the doctor. But for people with anxiety disorders, this anxiety is not just temporary nervousness. It can be overwhelming, constant, and really disruptive for everyday life. To keep things simple, I like to clarify that everyday worry that we may feel that is not capital A anxiety disorder, we can name little a anxiety. This is the experience that we all know well, but some of us, myself included, have to also live our lives capital A anxiety. In this lecture, we'll walk through what it's like living with different types of anxiety disorders. Along the way, I want you to think about how these experiences impact work, relationships, and a person's well-being. And because we all, to a degree, experience little a anxiety, think about what recovery from an anxiety disorder would realistically look like. Let's begin with generalized anxiety disorder. Imagine waking up every day with a sense of dread that something bad is about to happen, even when nothing specific is wrong. People with GAD often describe their minds as stuck on worry mode. They may worry about money, health, family, school, or work, anything in particular, but the worry doesn't turn off. Even when we're confronted with factual evidence that things are actually okay and not as bad as our mind is convincing ourselves they are. According to the National Institute of Mental Health, GAD affects 3% of adults in the US each year, and it often is accompanied with physical symptoms like restlessness, muscle tension, fatigue, trouble concentrating, and difficulty sleeping. Take a moment to reflect on how might constant, uncontrollable worry affect someone's ability to focus in class or at work. The next anxiety we'll cover in this module is panic disorder, and you actually have a case study to take a deeper look at this specific anxiety disorder. Panic disorders include episodes of panic attacks, which are sudden surges of intense fear that come seemingly out of the blue. People often describe them as feeling like they're dying or they're having a heart attack, or there's this sense of impending doom that only they are privy to. Symptoms include a racing heart, shortness of breath, dizziness, sweating, and chest pain. All of those kind of sound like a heart attack. So it's understandable that panic attacks can be pretty scary for the person who's experiencing them. After experiencing panic attacks, people may develop a fear of having another one in the future. This fear itself can become disabling. In fact, many people who experience panic disorder say that their distress comes more from worrying about when a panic attack may happen than actually writing out the experience of a panic attack. Some people stop going to places where they've had panic attacks before, which can lead to agoraphobia, or avoiding public spaces, and even avoiding leaving the house. According to the National Institute of Mental Health, about 2 to 3% of adults in the US experience panic disorder each year. Without treatment, it can dramatically shrink a person's world. Imagine not knowing when your body might suddenly go into fight or flight panic mode. How might that change the way you live day to day? Another anxiety disorder we'll cover in this module are phobias. Phobias are intense, irrational fears of specific objects or situations. For example, a person with a phobia of heights might feel dizzy just climbing a ladder. Someone with a phobia of flying might avoid traveling by airplane altogether. People with phobias often know their fear is excessive, but that doesn't make the fear go away. Phobias are actually among one of the most common mental disorders in the US, affecting about 12.5% of adults at some point in their life. While avoidance behavior might reduce fear in the short term, it can severely limit opportunities and impact relationships. Pause for a moment and think, what are some examples of how a phobia could interfere with someone's career or personal relationships? And last but not least, another anxiety disorder we'll cover in this module is social anxiety disorder. Sometimes misunderstood as just being shy or not liking crowds or even being introverted, social anxiety goes way beyond just shyness or introversion. People with this disorder experience intense fear of being judged, embarrassed, or rejected in social or performance situations. This can make everyday activities like just eating speaking in front of others, making phone calls, or giving a presentation in class feel terrifying. The National Institute of Mental Health estimates that about 7% of adults in the US have social anxiety disorder in any given year. Left untreated, it can lead to isolation, limited career opportunities, and difficulty forming close relationships. Take a moment to pause and reflect. How might social anxiety affect a student in college trying to participate in a group project or make new friends on campus? Although each of these anxiety disorders is unique in their own regard, there are some common experiences that they all share, like persistent fear or worry that feels uncontrollable, physical symptoms like rapid heartbeat, sweating, or dizziness, avoidance behaviors that can limit daily life, and distress that interferes with relationships, school, and work performance. Living with anxiety often means making choices based not on personal preference, but on fear, whether it's avoiding public speaking, skipping a social event, or planning out every detail of the day around one's worries. However, it's important to know that anxiety disorders are very treatable. Some treatment options currently used for anxiety disorders include cognitive behavioral therapy, which helps people identify and challenge those anxious thoughts and what-if scenarios, or helping people gradually face feared situations through controlled exposure. Medication for anxiety disorders often includes SSRIs or anti-anxiety medications that can help reduce the physical symptoms of anxiety. Mindfulness and relaxation techniques can also help to manage the physical and mental effects of anxiety. And most importantly, support systems like friends, family, and community play a big role in recovery. If we think about what recovery looks like for anxiety, it doesn't mean that we'll never feel anxious again. Remember, we all experience little a anxiety. Instead, recovery means learning to manage anxiety so that it no longer feels like it's controlling your life. So this week, as you go through the module and you study up on each specific anxiety disorder, keep in mind that behind each diagnosis is a lived experience. A student who avoids speaking up in class, a parent who may be afraid to leave the house, or a coworker who's exhausted from worrying before they even show up for their shift. Here's a reflection for you that I would like you to answer in the comments below. You can feel free to pause the video and reflect on this question, and then when you're ready, type out your response in a comment. How can understanding the lived experience of anxiety change the way we respond and support people living with these disorders? Thank you for your attention in this overview lecture, and I look forward to seeing you in the module.